Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I would like to give you our weekly update of the COVID-19 pandemic in the state of Maryland and at GBMC. Across the state, the number of hospitalizations are down somewhat, and as I speak to you at GBMC, we have 9 COVID-positive patients in the hospital and 9 other patients who are awaiting test results who might be COVID-19 positive. Of the 9 positive patients, only 1 is requiring mechanical ventilation. At GBMC, we will continue to check people on entrance to our campus to assure that they don't have a fever, and we will continue to ask them about symptoms associated with COVID-19. We will continue to require that people wear face masks on our campus in common areas. And why are we doing that? It's because some people will have COVID-19 and not yet realize it. They won't have any symptoms, and the facial coverings are to protect others. There's also work going on to restart elective surgery. We have been doing urgent and emergent procedures all along. We've been doing 12 to 15 surgeries a day. But now we will also do those that have been waiting. But we have to make sure that every patient that is coming for a procedure is not infected with COVID-19. Therefore, we will require a COVID-19 test of everyone having an elective procedure. We have tents on our campus, and one of them will be used starting this Monday for COVID-19 testing. The testing must be done within 72 hours prior to the procedure. The other thing that we must pay very strict attention to is personal protective equipment for our staff and also for patients. You know from the news media that this has been a big problem across the country. We now believe that we have enough personal protective equipment to safely restart procedures. We will watch this very closely. Obviously, if we see that we're having outbreaks of COVID-19 or that the risk of COVID-19 goes up significantly in the community, we will bring the elective procedures back to a halt. So we must maintain that social distancing of 6 feet away from others and wash our hands frequently. If we all do this, then the fact that we are now traveling to stores should not increase the risk of getting COVID-19. So I want to thank all of you for not being afraid to come back to GBMC or your doctor's office to get required health care. We will continue to use televisits. If you have issues, please check with your doctor. He or she will decide whether or not you need a video visit or whether or not you should actually come to the office. Please do not stay at home with significant needs that are not being met. You will only get sicker. My commitment to you is that GBMC is safe. If you need care, please contact us and we will provide it. Lastly, this is Hospital Week, and we have been celebrating on the GBMC campus all of the wonderful men and women of our team, both clinicians and support people, who have stood tall thus far during the pandemic and will continue to stand tall to serve the community. As you know, our vision phrase is to every patient, every time, we will provide the care that we would want for our own loved ones. It takes a team, and this week we are celebrating that team. So thank you once again. Wash your hands, stay at least 6 feet away from others, and I hope to see you soon.